Thank you so much for all coming here, being here, and listening to everyone. If you have a lobby visit and you have to go and you know that, just get up and go. So I have to, again, say a great thank you to Joanne Smith, who I met when I was 17 years old. And she brought me, Alyssa and her brought me to speak at an FPA conference. And they had a lot of confidence in the ability of a 17-year-old girl to give a keynote speech, and I really appreciate that. Joanne is one of those women who, she made it up the ladder. She got to a position and she didn't pull the ladder up behind her. Instead, she's helped a lot of young women come up. I would also like to thank Tracy Brooks, whose vision it was today to have a very young person come and speak to this assembly. And also I would like to thank Sandra Rivera, who I am incredibly encouraged by her tenure at FPA, because the first thing that she said to me this morning was that she wants to make sure that young women are empowered to be leaders in Family Planning Advocates of New York. So I'm really excited that she's in there. It's quite an honor to stand on the same stage with all of these people who have spoken today, in the well of the New York State Capitol building, in front of activists, supporters, and maybe even a couple of people who are here to exercise their right to disagree with us. Welcome to all of you, and thank you for coming to the Family Planning Advocates of the State of New York Women's Health Matters Lobby Day. We are together this afternoon to mark the opening of the 2009 legislative session, and to celebrate a pro-choice majority, as someone noted earlier, in both the Assembly and the Senate for the first time in 50 years. What promise those words hold for the women, men, and children of the state of New York. We're here as activists from all over the state to remind our legislators to live up to that promise by passing the Healthy Teens Act, to equip all you New York teens with the information to keep them safe and healthy. We're asking you to live up to the moment by taking abortion out of the penal code and putting it into the health code where it belongs with the passage of the Reproductive Health Act. We're here to thank you for all the hard work you've done already, and to bring you stories from the front lines that will require even more hard work on behalf of women's health in this session and in the years to come. We're here to be together as a family of activists, to strategize and re-energize and plan for the future. It's a special day, and we will never be together in exactly the same configuration ever again. Think about that. We'll never be in this room ever again. With that in mind, I hope that everyone here today learns something, teaches something, and leaves with the phone number of a new ally, or a job interview, or a new organizing idea, or maybe even an itch to run for office, hopefully out of inspiration, not out of frustration. I am, as I said, to put it mildly, a bit overwhelmed to be standing in front of all of you today. Things like this didn't exactly figure into my life plan when I was 15 years old and standing in front of a very different group, my Southern Baptist Church, making a vow to God, my parents, and my future husband to remain a virgin until marriage. Of course, it wouldn't have been. I'm from Lubbock, Texas, second most conservative city in the nation, and still the only police force to have ever arrested the Chippendales. Lubbock was an all-right place to grow up, especially since I didn't know that other states, like this one, probably thought that some of the things we were doing were a bit backwards. Take the virginity pledge. Most of my peers took it, broke it, and would never admit to doing either. I took it because it's what a good Southern Baptist girl does in Lubbock, Texas. And at 15, I actually wasn't all too clear on what I was vowing not to do. Statistically, Lubbock had some of the highest rates of teen pregnancy in the state, and the highest gonorrhea rate amongst my age group in the entire nation. Something quite to be proud of. You know, we didn't think about sex ed. It's not like you go around as a young person thinking, this is what I should be getting. We didn't think about it like that. We thought about it in human terms. My human terms came in the form of a girl named Monica, who I sat with in math class and passed notes to every single day because we both hated math. One day she came in, she said she had to tell me something, and she didn't know if I would be friends with her afterwards. I said, well, what could it possibly be? And she said, well, I'm pregnant. And I was sort of confused. I didn't actually know how that happened either. But I just said, how did that happen? And she said, well, he said I couldn't get pregnant my first time. And that was the first personal example. And it really made me think that day. And so I started looking around at my other peers, and I joined a group called the Lubbock Youth Commission. And I think really looking back, they thought we were going to do like teen loitering or something. But you put 36 kids together in a room, and every single one of them has a story of a friend who got pregnant, or a friend who impregnated someone and has had to drop out of school and start going to work, or going to the STD clinic and being ashamed and not knowing if you were going to get the correct information. We decided to start working for comprehensive sex education. We found out what many of you probably know, that abstinence only is a political policy that the United States government has spent billions on over the past 30 years. We also found out that abstinence only doesn't work and is ineffective and is a waste of taxpayer money. In fact, about $126 million a year. We realized the programs had very little oversight and often contained medical inaccuracies and religious overtones. This discovery that my friends' lives were being derailed because of political squabbling was my political awakening as an activist. The beginning of seeing that not the government and public policy don't necessarily always have women and young people's best interest in mind. Y'all might have gotten that. And that is our responsibility. It is our responsibility as citizens to police those policies and use all means of social action to pull them back into line. As teens, we knew innately what would work. It's our lives, after all. We knew that teaching us about abstinence and birth control wasn't an oxymoron, but it was reality. And that consistent age-appropriate messages throughout school would work far better than a bam bam thank you ma'am lecture sometime in PE, sometime in middle school. Turns out the statistics and public opinion agreed with us. As you already know, or you will learn today, age-appropriate, medically accurate, comprehensive sex education helps delay when young people have sex, increases their condom and contraception use when they do have sex, and decreases the number of partners a teen has. Most parents, 88% of them in the state of New York actually, want their kids to have comprehensive sex education. As I travel across the country as an activist for this, most parents think their kids are already getting it. They think that they're getting as good a sex ed as they were getting when they were young. They don't realize what's being taught in school. And best of all, we've talked a lot about the economy today. Comprehensive sex education is an investment for the taxpayers. If the rates of teen pregnancy in the United States equaled those in the Netherlands, which has the best sex education in the world, there would be 617,000 fewer teen pregnancies every year, which would come to a taxpayer savings of almost $542 million a year. Despite all of this, and we knew this, Lubbock never came around. Instead, defunding the Youth Commission because we had overstepped our mandate. Lubbock still has some of the highest rates of sexually transmitted infections in the country. The fight turned into the documentary film, The Education of Shelby Knox, which laid out for a nation that doesn't really like to talk about sex ed, about the stakes of leaving the abstinence-only policy of the Bush administration in place. When I began traveling with the film, I didn't think of myself as an activist. I saw a problem that was affecting me and my direct peers, and looked around to see if someone was going to say something about it. There wasn't anyone, so there wasn't any choice. I used my voice because no one was going to use it for me. But as I traveled, I realized I couldn't be done using my voice. I told my story, and so many young women told me theirs. A young woman in California was telling me about her struggle with a pastor who, after she came out to him, told her whole family. A 15-year-old girl in Nashville, after I gave a speech, came up to me, told me she was pregnant, and asked me if she could help me tell her mother and ask her mother if she could have an abortion.